Hello, I'm Dr. Anil Guri. I'm a consultant in reproductive medicine and assisted conception at Fertility Plus and Fertility Courses. And it's again an update on the journals that I read and what I can gain from it. And so, how many IUIs is too many? And that's the question often asked is when do we stop doing intrauterine inseminations? Do we stop it at one treatment? Do we stop it at two treatments? Do we stop it at three, or do we stop it at six treatments? And that is something which we have been thinking of for a long time. So, let's look at this paper, which was, and I've reviewed this paper from Fertility and Sterility. Now, what they did was they had the objective was to evaluate pregnancy with ovarian stimulation and IUI up till 8 cycles. And a large group of patients, 20,831, and it's 2002 to 2019. PCOS and donor were excluded. So when you looked at the mean clinical pregnancy rate, it was 12.6. The clinical pregnancy rate in cycles 1 to 6 was 12 to 13.7%, while the clinical pregnancy rate in 7th and 8th cycle was reduced to 12%. The cumulative pregnancy rate from cycle 1 to cycle 6 was 31.9%, and the cumulative pregnancy rate from cycle 1 to cycle 8 was 33%. So what does study to a certain extent tell you? That around 6 cycles of treatment will give you a live birth rate approximately from between 28 to 31%, which is a reasonably good live birth rate and brings it in line with that of IVF. Now, in cases where you have to extend it, the cumulative benefit of doing additional IUIs, especially in heterosexual couples, is limited. Now, often we get asked in clinic is, what treatment should I try and do? And my way of looking at it is, what is the biggest complication of assisted conception? Any form of treatment. It is trauma. It is psychological, emotional, and mental trauma that comes with failure. People say it's financial and it's physical. No, all those are somewhat surmountable, but it's the psychological trauma that couples pass through and the emotive trauma that couples pass through, which takes a toll on their health. And so I'll often say, do you have enough to go through 2 or 3 or 6 rounds of treatment? And if that is so, then I'll say, go ahead and give it a try. But on the other hand, if we have less treatments to go ahead with, then I'll say, well, it's something worth looking at whether you move towards IVF slightly earlier rather than later. So this is, quite a good study. It is to a large extent prospective, and it is not a randomized controlled trial. But equally, it is giving us a far better idea into what are the options that we go for, and it gives us a certain amount of information with which we advise patients. Until 6 cycles, you're looking at a success rate which is close to 1 treatment of IVF, but provided the couples are young and under the age of 38. And as women enter their 40s, the chance of pregnancy automatically goes down. So where do you stop? Do you stop at 3 and 6? And that discussion often is you have with your patients. And often I tilt towards upgrading treatment after 3 cycles, mainly because by that time, I believe couples have lost hope that this treatment would work. And and many of us would not have patience to continue with another 3 treatments of intrauterine insemination. And now in the same-sex couples, that is entirely different. And I think there you should give it a trial for at least 6 treatment cycles. Thank you very much.